Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the CodeCast podcast today. My name is Terry Fletcher. So we are now in October. How exciting. It's my birthday month, and my Steelers are doing great. Now, I am pre-recording a couple of weeks in advance only because I have some traveling I'm due for work and for pleasure, and so I wanted to make sure I had these banked so that I didn't miss a Tuesday. Have not missed a Tuesday since November 1st of 2017. So we are over, what are we now at? Over in all of our platforms, almost at 2 million downloads and listeners. So thank you to everyone. I just appreciate that. If you get a chance, we're still open for the People Choice Awards, for podcast awards for Best Female Podcast. Thank you again for the nomination. It is our 7th year podcasting and our 5th year nomination and our 2nd year top 10 and our 2nd year top 5. So we're just waiting for more votes. So go to podcastawards.com. But again, thank you for that. So one of the things I wanted to talk about today, and actually it's going to be I call it this kind of a quick hit, just really looking at some of the things that have been posted lately that are around, that are hot topics. And because we are dealing with some of the things that are going to happen at the end of this year as far as expiration dates on telemedicine, we're in a political year. We just don't know what each administration or the next administration is going to do. One thing I found that AMA has been talking about, and I know they're definitely a pushing proponent of telehealth. I am too. I love telemedicine, but I also know that it needs to, and I hate to put it this way, but stay in its lane when it comes to an additional delivery of medicine, not instead of. And in saying that, I know that we still have a lot of providers, physicians, and some mid-levels that are doing telehealth or telemedicine visits from their home still. I hope that does change since the pandemic ended in May of last year. And so it's, as far as necessity, it's more of you're doing it because of financial reasons, not for maybe what's best for the patient. And also physicians that are actually in clinic, where are they when they're providing these services? And if it's a new versus established patient, audio and video. Remember, audio only is not available for new patients anymore. So I actually just did an audit for 2 major payers on that, and boy, did they get in trouble for doing all these audio only for new patients. Don't do that. But when we talk about the telemedicine or telehealth video, what I'm looking at is the background. And I call this website manner. And I have this in a lot of different website manner in a lot of different webinars I do on telehealth. And I've been talking about this forever. And a lot of things have come to the attention of different studies now. Researchers from the University of Michigan Medical School, researchers at Veteran Affairs in the Ann Arbor healthcare system, and then researchers in Cigna Healthcare. They have been looking at, they call it pulling, the curtain back, and they're trying to figure out, does the physician's academic or training background matter to patients when it comes to telehealth? Because we also have a lot of panel physicians that belong to payers now. But these studies that was also published in the Journal of American Medical Association, it's called the JAMA Network Open, they talk about this principle of what patients see behind their doctor's visits during virtual visits, noting that most physicians actually lack training in the quote-unquote website manner, they use my term. And so they looked at a survey of over 1,200 patients from their respective institutions to measure preferences regarding the visual background seen during a video visit. And here's what they found. So patients were shown pictures of a physician with a solid colored background, informal backgrounds showing a kitchen, a bedroom, and a book-filled home office, a formal background showing an exam room, a sparsely decorated office, and then an office with diplomas on the wall. So the backgrounds were rated by patients on a scale of 1 to 10, with high scores showing greater preference across 6 different domains, meaning how knowledgeable, trustworthy, caring, approachable, and professional the physician appeared to be based on the surroundings, and how comfortable the physician made the patient, or what they called respondent, feel. So bedroom and kitchen background scored the lowest by a significant margin. So my question was, why is the physician doing a virtual visit from their own bedroom? That's creepy. So I'm just going to say that. That is really creepy to me. Now, I get certain patients who are limited in mobility that may be sitting up in their bed, or they have their feet up with their head against their backboard or their headboard. Maybe that's, just what they're comfortable with maybe a caregiver there. And a lot of patients, maybe they're in their kitchen sitting at a table because that's where the strongest internet is. I get patients. I don't get providers. That to me is not okay. And this research survey basically shows that. The home office, exam room, and the solid color had about the same score. Meanwhile, the physician office background was slightly ahead of those backgrounds. Now, backgrounds that had diplomas on the wall was also far ahead of any of those backgrounds. The researchers calculated that the background with the diplomas on the wall, or showing them, was preferred 34.7% of all respondents, compared with 18.4% for physician's office, 14.4% for solid color background. I guess they found it boring. 3.5% for the bedroom and 2% for the kitchen. I don't want to know those people who thought 3% was the bedroom was okay. So also numerous studies have found that nonverbal communication to be a modifiable determinant of patient trust and satisfaction. Nonverbal means the surroundings. It means your positioning. Again, your webside manner. What does the patient see? I was actually talking to a physician, a provider, who had their mail in their background, and I could read it. And so the magazines I did not think were professional, that the patient needed to know. They subscribed to those. There was a couple of their bills. One was a credit card bill that was open on the back table. I'm just like, why would you do that? You don't want anything to be picked up on camera. And the researchers wrote that, adding that health systems should prioritize having physicians perform telehealth visits with traditional environments. So if you want to be taken seriously on the telehealth front and you want things to be extended, then this is really important, because Congress is moving in a direction where we are going to get some permanency on a lot of the extensions that we have right now. So even as research continues into patient preferences for telehealth and telemedicine, and what blend of virtual and in-person visits generates the best outcome, the December 31st deadline for extending, I should say, and making permanent some of the flexibilities granted during the COVID public health emergency, we are getting closer to that. Now remember, unless Congress acts, and we don't know in a political year what they're going to do, but I think some things are definitely going to go through. We could be going back to some of the outdated regulations that was pre-COVID, and before cell phones actually, and smartphones, that you were not able to just be in your home as far as the patient, where they had to be in a HRSA area, or an area that was like a critical health hospital, critical access hospital, or an outpatient hospital. They had to be in a setting that wasn't their home, and they also had to be in a geographic location area that didn't have a physician within 50 miles. So a couple of these bills preserving telehealth, hospital and ambulance access. There's also some bipartisan bills that calls for extending exemptions to the geographic and originating site restrictions on telehealth services, so that beneficiaries can continue to receive services in their home. Some things is about requiring an in-person visit within 6 months of the beneficiary receiving their first telemental health visit. And then they are looking at considering authority to offer audio-only telehealth services even further, because remember, the 99441 to 443 is going to be deleted, are going to be deleted in 2025. Now, they did publish the new codes. It's hard to get a copy. I do have a copy, but it's hard to get a copy of that. So make sure you are looking for that, or at least get your new CPT book, which comes out in October. But between AI implementation and some of the new technology to make this work, it's just so important that you really consider the basics and going back to, what is my website manner? Train your providers. Have them understand that if you're going to get paid parity with an office visit, with an E&M service, with an in-person visit encounter, then you need to make sure that your virtual visits are on par with those. That's what parity is, meaning you're trying to get that same consideration from a reimbursement perspective as you in virtual as you are for in person. Now we know it's not the same because obviously you can't take a physical exam, but you want to get as close as you can for the presenting problem that's appropriate for telehealth. And if it's not appropriate, so if it's a patient who's having chest pain or a patient who has a palpable mass or something that needs some kind of in-person visit, then that needs to be appropriate for the patient, and try not to just push it off to telemedicine. Things can be missed. I know recently, and I'm actually annoyed by it, my daughter had her first, because she changed insurance with her, she was a teacher, and she had her first primary care visit, and it was telemedicine. I'm like, for a new patient, that's weird. And she's, they've referred her to an OB, all this stuff to just work her up and establish care. But she had some female issues last year that I'm just like, well, that doctor needs to see her. She also put on a little weight. So I'm like, they need to see you to see what you need to do about that. And it was all telehealth, and so there was no blood pressure taken. There was no, listening to her lungs. There was no, doing a basic breast exam, or seeing how she got up out of a chair, or seeing if she had anything, any kind of skin lesions that you're concerned about. So audio video only goes so far, and I was very concerned that this was okay with the provider's office, and they try to charge a high level visit, and she's in her 20s. So I would take issue with that. I audit a lot of telehealth services for payers and for providers, and I'm pretty conservative. I don't like to say strict because I do follow the rules. Even if I don't agree with the rules, I do follow them when it comes to auditing and reviewing these services. But I'm also very conservative that if you're borderline, I'm going to borderline on the other side, saying that I don't want you to be exposed for an audit or inviting risk. So make sure that this is something that you start with now, because I don't think that was actually considered when everyone pivoted to virtual care and telehealth services back in 2020. So if you haven't done an in-office workflow or audit on these on background, if you have providers that are still at home seeing patients, you need to make sure that you are very strict about your compliance plan and your policy on what needs to be in the background, what rooms need to be appropriate, where the doctor can be. Definitely encourage them to be back in the office, but if they are seeing patients from their home, make sure you let them know that bedroom is inappropriate, nobody likes the kitchen, it needs to be a professional space. So I just hope that can be helpful to anyone who's still doing things from their home if it is a provider. On a personal note, everyone's always asking me what I'm reading if it's not work. I'm actually reading the book by Melania Trump. It's actually really good, and just what her journey has been coming in as a legal immigrant and going through the presidency with President Trump, and just, and then all the things that he's had to go with from her perspective and her family's perspective. And it was just really just so insightful, and I'm just reading it right now. And I head to Hawaii with my husband here shortly for our 25th anniversary celebration, which was in July, but we try to get to Hawaii at least once a year. We didn't get to go last year, but we are going this year, so for a week or so next week. So hopefully I'll get to finish that book and we'll have a relaxing trip, but I will not miss my hashtag Terry Tuesday with Sean Weiss. I will not miss the CodeCast, so just know that that's always going to be there no matter where I am in the country. All right, everyone, make it a great rest of your week. Make it a great day, and thank you for listening to the CodeCast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.